Module 1, Assessment and Diagnosis of Concussion. The definition of a TBI is a traumatically induced brain injury as a result of an external force accompanied by at least one of the following clinical signs immediately following the event. Any period of loss of consciousness, any loss of memory for events immediately before or after the injury, which is referred to as post-traumatic amnesia, or any alteration in mental state at the time of the injury, to include confusion, disorientation, or slowed thinking. External forces may include any of the following: the head being struck by or striking an object, the brain undergoing an acceleration or deceleration movement without direct external trauma to the head, a foreign body penetrating the brain, or forces generated from events such as a blast or explosion or other force yet to be defined. Common causes of TBIs include motor vehicle crashes, falls, which is the leading cause of mild TBI in elderly populations, sports injuries, military blasts, bullets, or domestic violence, including blows to the head. The following is a table of the severity ratings for TBI. This rating involves mild TBI. For mild TBI, the loss of consciousness is between 0 to 30 minutes with a normal CAT scan or MRI. Alteration of consciousness should be less than 24 hours, as well as post-traumatic amnesia for less than 24 hours. If Glasgow Coma Scale is given, the score should be between 13 and 15. Most of the time, we're diagnosing mild TBI retrospectively. Patients often do not present to the emergency room following a mild TBI. As such, we typically distinguish between the three types of TBI by having the patient estimate the degree of loss of consciousness or alteration of consciousness. A common misconception among patients, and possibly providers as well, is that traumatic brain injuries are diagnosed or defined by CT scan or MRI. The majority of TBIs, even moderate or severe ones, will not show evidence of neuroanatomical change. However, just because there are not structural markers of change in TBI does not mean that it cannot alter neuropsychological function. It should be noted that scans should be considered if intracranial bleeding is suspected. This is an important consideration in older adult patients especially, as this group typically experiences high rates of intracranial bleeding after sustaining a head injury. Assessment of TBI can be done through an unstructured interview, inquiring about the event, loss of consciousness, alteration of consciousness, and post-traumatic amnesia. First, characterize the injury and gather detailed information about the event. This includes the mechanism of injury, the duration and severity of alteration of consciousness, and immediate symptoms. Also assess symptom course, premorbid conditions, and potential co-occurring conditions. Common questions to assess alteration of consciousness include: did you feel dazed or confused? And for how long? Did you see stars? Did you feel disoriented? Did you feel that time slowed down? Can you remember everything that happened, or are there gaps in your memory? Where are the gaps? A helpful structured interview is the Ohio TBI identification method. So far, we've talked about the assessment of TBI, which is simply about the event itself. not symptoms related to TBI. These are sometimes called post-concussive symptoms. The physical symptoms following a mild TBI include headache, dizziness, balance problems, nausea, fatigue, sleep disturbance, blurred vision, light sensitivity, hearing loss, and noise sensitivity. Next, we will discuss in more detail the cognitive and psychological symptoms related to concussion.